ask a quick question? Okay. Would we be able to get kind of office hours specifically for Fifth Avenue Committee by any chance?
Yeah, I think we can talk through that. I think it would depend on what the question is related to. If it's Unite Us, like workflow related, you could submit that form that we had sent out. We can send that again. Maybe we can put it in the chat actually, and we can set up a one-on-one if it makes sense.
Okay.
Definitely a lot of familiar names and faces and people that I have personally reached out to. So hopefully I was able to answer your questions. And if not, it's not me, somebody else.
Welcome everyone who's been joining. We'll get started in just another couple of minutes, give people a chance to join the Zoom.
So will you be able to share the workflow? I think those are all for you.
Oh, yes. Thank you.
And just as a side note, everyone, this meeting is being recorded, but only for our purposes in capturing notes and Q&A, just for our own internal use, will not be distributed.
And to that point, if you would please be so kind as to use the Q&A button down below, we will be monitoring that. So please add your questions there and we will go through them either live or in the actual Q&A section. But we will respond to all questions if we don't get a chance to answer everyone's today. Thank you.
Great. And it is 1:05, so we'll get started. Thank you all for joining today to our PHS office hours. I know we sent out an email yesterday, but just wanted to recap that as we move forward and have organizations joining the platform in an iterative process, we want to ensure that we're aligning and organizing office hours in a way that's going to be most productive for organizations at different points in the process. So today, we are going to have breakout rooms that have specific topics. We'll have one for the partner registration forms, which are due by the end of day today. If you would like to be a part of Wave 3, which will be March 18th. We'll also have a breakout room related to the MSA attachments, BNI. And then the last one will be related to capacity building funds application and the HRSM calculator. I will note that this particular breakout room will be best suited for individuals who have already had their MSA executed and who we have sent the application to. We will be doing a full demo of the HRSM calculator for all partners in our next stakeholder group call on the 19th. So we will be able to show it and we will be providing it as a follow-up from that call next week. So if you have not executed your MSA yet, you will have the opportunity to get a full demo and ask in-depth questions next week as well. And then as mentioned in the email, we also have office hours hosted by Unite Us, but with PHS representation happening on Tuesdays and Thursdays throughout this entire month. And those are particularly meant for organizations who are on the Unite Us platform who've launched. And again, we'll have Unite Us and PHS on the call for those office hours. they're mostly happening from 12 to 1. I think one day is 3 to 4, but we had sent that out. So configuration and technical questions will be best suited for those Unitas office hours. Okay, and with that being said, I think we can go ahead and release the breakout rooms, and it'll essentially pop up and you will have the ability to join whichever one you're interested in. We'll keep them open for as long as makes sense. And so if you want to join one at one time and another, there'll be time to do so. But feel free to join whichever one you have questions related to, and we will have PHS facilitators in each one. Thank you.
So if anybody needs any assistance with getting into the rooms, please let us know and we can assign you in as well.
I would like to be assigned in group 5.
Was that Yaneris?
Yes,
Okay, which room?
5.
Which room do you want to be assigned to? PRF, registration, master services, or capacity building?
Oh, I thought it was the ones listed in the chat. Sorry.
Okay.
Is there something that's supposed to pop up for us to go to the room?
At the bottom of your screen, where right next to share or Q&A, there should be a button for breakout rooms, or click more, and there should be a button. If not, I can assign you.
There's no button.
Gosh. All right.
Melanie, which room would you like to be assigned to?
Capacity?
Okay.
And again, if you look across the bottom of the screen where you see the Q&A question box next to it, there are 3 dots that say more. If you click that, you should get a pop-up screen, and there you'll see breakout rooms. When you see that breakout room, you'll see all the names of the attendees there. And if you scroll down to the bottom, you will see options to join rooms.
Excuse me. So I have some questions regarding the workflow on Unitas. Which breakout room should I go?
You could stay here. We could probably
Yeah.
field that
Okay.
question in this main
Yeah.
room.
Okay, great.
Look at Esther taking over the room. I like it. We've got
Yeah.
4 rooms now. This is officially the Unitas room.
Yeah, Esther, what are your questions?
Yeah, so in the past 2 days, our team conducted a couple of screenings, and I believe my role is both the intake, the case intaker and navigator, but I was trying to help the client to see if the client can get any enhanced service. But it seems like on my page, I cannot see the eligibility assessment, which based on my understanding, we need to see, we can only do the enhanced service navigation based on the eligibility of the client, right? So can we determine their eligibility? All those eligibility were predetermined by their provider. And what can we do? I'm not sure if this is like a Unitas question or
Yeah, so it might be something that you might have to submit over to Unitas, but we can give some background and like preliminary information. So first and foremost, your organization would have to be contracted to provide both screening and navigation services. Otherwise, you would be limited to only.
Which I think we
being able-
do. Yeah.
Okay, so
Mhm.
if that's the case, then yes, this might be something that you want to fill out the form that I think has been dropped in the chat. Yes, I'll
I just
copy it
placed it
again.
back in there. I just placed it back
Okay,
in.
thank you.
Yeah.
Thank you, Candace. So yeah, you might want to reach out. There is the ability for you to conduct the screening and then move on to navigation. It'll be in a different screen, and so you would just have to move over to the face sheet. It has a tab that
Right.
says eligibility assessment. You should be able
Yes.
to find it there. So it should be something that you can do seamlessly, one after another. And if not, again, just fill out that form that Ken just put in there in the chat, and they can, Unitas can make sure that you are configured to be able to provide both.
Okay. Okay. Thank you.
Of course.
Yeah, and also I have a question regarding some items on fee schedule. Should I go to any break room or I can just ask here?
If you have questions about the fee schedule,
Mhm.
you could potentially go to the MSA
Okay.
breakout. Yeah.
Okay. Okay. And also, another question, I'm not sure if you can answer, or maybe I should reach out to Unitas. So on Unitas, do you know where can we put the invoice amount for each survey, for each client we worked on? I remember when Unitas staff did a demo last week, there is somewhere that we can put how many minutes we did on the screening for that client, and do we all have the access, or only the people who is in charge of invoice, who is in charge of finance has that access? And how can we calculate? Do we need to just jot down a note on how many minutes we worked on that client?
Oh, go ahead, Sam.
So there should be at the end of the screening, the ability to put how many minutes you were with the client. The actual invoicing process is automatic though. But yes, you should be seeing a little box that says minutes right next to it at the end of the screening.
At the end of screening. I don't see it, but if we already fill out all the screening answers, can we go back to put the minutes in? Because
Candace, you want to say something?
I think someone's talking behind you in the office, Sam.
I'm sorry, I'm gonna mute my.
Interpretation. So part of it has been guided by, PHS's decision has been guided by not only state guidance, but also, as mentioned, the I-Corps capabilities assessment that included the interviews and surveying with organizations, with Medicaid members, and then also ultimately the review of our governance committee. So that's, I guess, where our guidance comes from. But I will note both the Collaborative for Children and Families and Services for the Underserved and get back to you all about.
Okay, thank you.
And Mark?
Thank you. So the representing Anthos Home, and our question is when we'll hear about a response to our capacity building application. We submitted it pretty soon after we got it, which I think was early this month. And it's just a small organization that is ready to expand, but can't really dedicate the staff to expansion until we get that seed funding through capacity building. So just for planning purposes, we're not sure, is it a rolling application? Is there, are we gonna have to wait till the end of the month to hear back? Do you have any indication of how soon we'll get a response?
Definitely, thank you. We are looking at applications on a rolling basis. I believe we'll start reviewing this week. I can't give you an exact timeline, but I know we want to start giving notices as soon as possible, understanding that a lot of these funds are important for organizations to really build up services. So can't give you an exact timeline, but definitely hoping to give answers sooner rather than later. And again, it's going to be on a rolling basis, not necessarily having to wait a certain amount of time. But that's the information I have right now.
Okay, and just one follow-up is, how will we know when we're ready to be given credentials to go onto the Unite Us platform? Because we've gotten some feedback in terms of contracting and insurance, and it feels like there's a few loose ends, but I don't think we've gotten any. We've gotten something about e-paces, but I don't think we've gotten anything about, here's your credentials, or you're ready to go on to Unite Us.
Yeah, there are three main dependencies for going live on Unite Us. One is the MSA execution, which is already done. The second is meeting the minimum training requirements per organization. We have I apologize, I don't know off the top of my head yet everyone's status, but don't know where your organization is in terms of training. But we have minimum requirements per organization. And then the understanding is that if individual users are actually providing services, they must attend the training related to their role. So screening, navigation, enhanced care delivery. And then the final aspect is the partner registration form, the PRF. That is the Unite Us configuration form that essentially builds out what is shown in the platform. I can try to check if your organization has submitted a PRF yet, but that is due today if you would like to be on the platform by 3/18. But those are the key dependencies. And then there's additional information that goes out from Unite Us whenever you actually launch in the platform. And we also have a lot of other information in terms of like e-paces and extra scripts and extra resources that we send out once you're actually going live. But those are the three main.
So I can just say, I thought we were in the February wave. I personally attended all of the trainings, but as I said, the staff that's going to actually be, assigned to things like screening or billing, we would need the infrastructure funding before they could be assigned to attend the trainings. So, so you could get back to me and let me know if your records don't show the same, that we've completed the 4 trainings. We're in the.
Hello. Hi, Alina. Can you hear us?
Hello.
You're unmuted. Okay, there we go.
Oh. This is Tom. My assistant registered me. That's why
Gotcha.
Yeah, I was trying to find my name. I said, what? Okay, now.
Hi, Tom. Yeah, you're under Yelena.
Okay.
Yeah, so you're the only one here, so feel free to ask any questions regarding payment, registration form. Yeah.
No, what this is a partner registration. I just want to know what is the break room about, actually.
Yeah, so we're doing different breakout rooms for providers to kind of join, either ask their questions specific to the topic of the breakout room. So this one is like the partner registration form. So if you have any questions or just want like an update of if we received your partner registration form, this would be the best place to ask that here. We have the other breakout room regarding the MSA attachment. So if you have any questions regarding MSA attachments, maybe you want to understand how to fill something out, you would join that breakout room. And then we have the other breakout room, which is going over the capacity building application and the HRSN calculator as well. So just providing different breakout rooms to provide information depending on the topic that you may have questions for.
So we already signed the MSA, so it's already done. We don't need to do anything
Okay.
with registration. Right?
Perfect. And what about yours? So the partner registration form it's an Excel spreadsheet where you list your organization and the users. Do you know if you submitted that and which organization are
It's
you?
ACCO, Asian Community Organization.
Yeah, we have that.
Okay, perfect.
And so we have spoken with the team. And again, the only question that we would have, or it might be of interest to you, is should you ever change your users and the roles that they would be playing in the SCN, in which case then we would need to have an updated PRF form, just the user tab, so that way we could go ahead and provide that information to Unitas to amend your profile.
Oh. I think Esther was.
Yeah, Esther.
Yeah, Esther was sending some of the information yesterday, but I need to confirm with her. I wasn't in the email loop. She just forwarded me today. But anyway, I have a question. It's not related to this, but probably you can answer the question since I'm only one here. I have we also joined Haiti. They also use United Us. And so we use the same account. How do we distinguish if we have a candidate in on Long Island, Nassau County? I mean, we use the same user account to log in United Us, same organization with two different SCNs. How do we distinguish which one is what? I was kind of confused because Haiti did not answer the questions to us.
No, yeah, that's fair. So yes, you'll be using the same login for Unite Us, but in Unite Us, you'll have the option to select which profile you're going to be using. So you'll select the profile specifically to the whole UNYC SCN to receive those referrals and provide those SCN services. And then you also have a profile under Healy so that you can receive those referrals as well for those services. So you use the same login, but you have two different organizations on the platform for you to use.
Oh, so every time I want to, let's say, do a screening for Haiti, I need to switch the profile first.
Yes, you have to go under Healy's profile. Exactly.
Oh my God. Okay. It's so confusing. Sorry, it was so confusing about that.
Yeah.
Yeah. Okay.
Yeah.
Yeah. So we had a couple of candidates like this. We're not sure. Then how do I know this is for? So the people in Long Island will belong to Haiti, right? It's not
Exactly, because our SCN is only covering Brooklyn, Manhattan, and Queens. Exactly.
Queens. Yeah.
Yep.
Yeah. So Little Neck is belong to Queens. It's on the border.
It's a Little Neck.
Yeah.
I'm not too familiar.
Yeah, Little Neck is on the border of Queens, but I don't actually believe that it falls in the jurisdiction of the county.
Okay.
Yeah. So we have one candidate. This senior is living in Little Neck but attending Social Day in Nassau County. So we don't know.
So everything is based on the address of the Medicaid member. So if the member resides in Queens proper, then hi Esther. So then that's not an issue. If the member residence is outside of the borough of Queens, then it would need to be referred to that corresponding SCN.
Oh, okay. So it's by the address.
Yes.
So is there a way I can validate? Let's say if I go to PHS profile and then we did the screening everything, then we won't be mistakenly. I don't know. I mean, will you? I just want to make sure this person, you will automatically recognize this person as a resident in Queens, not Nassau County, right?
So a quick Google search says Little Neck does fall within the Queens,
Yeah,
so you should be good there.
we should be good, right?
Yeah.
Yeah, because
Yeah,
the phone
this-
number, everything is Long Island. This person using a 516 number and attending the social day in Long Island, so I was kind of hesitant to do anything in PHS.
Yeah, well, people have phone numbers assigned to all sorts of different places, so you can't really use that as a gauge or barometer. You have to use the actual physical address that they reside at.
Okay, all right. Esther, Michael just
Yes.
asked
Mhm.
about if we have changed the user roles, everything, request sending information to PHS. I mean, yesterday I saw you. Sent
Yes, we
something there.
did. We did. And also we're wondering, since ACCO is a navigator as well, but right now nobody in among our staff users have the ability to do eligibility assessment on Unitas, which allows us to, do to determine if the client we're serving can get enhanced service. So that was also my question.
So this is a glitch that you are
Yeah.
seeing right now in
Okay.
Unitas, which is not just by you,
Mhm.
but by across the board. So we're working to have that resolved as quickly as possible. Again, that's on the
Mhm.
Unitas side as opposed to anything else. So I apologize that you're having that difficulty.
Oh, okay. No problem. Good to know. Not just us.
Oh,
Okay.
this is Tom. Following on this question, so do we need to wait for that glitch to be fixed, or we can start the screening? We're ready. We just
Yeah, we just did like a couple of screenings.
Yeah, that's a good question. I know that people have been able to screen, but again, it's the question of going in to see the eligibility for the enhanced services that has been the issue. So I don't know if that's been resolved or if that, what the status of that is. Unfortunately, I'm not involved in that line of discussion. But what we can do is we can definitely, I don't know if Haley has any idea on it, the ongoing issue with Unitas and the issue with eligibility assessments, getting clarifications.
Hi, no, I know that was flagged in the main, I believe by Esther, in the main
Yeah.
breakout session, having that
Yeah.
issue of not being able to see the eligibility assessment. I don't have further information, but I think I believe Candace dropped in the chat, Esther, a link to the
Yes, the,
tech support for Unitas.
Mhm, mhm.
Okay,
Yes,
great.
I think that would be the route.
Okay.
And I want to go ahead and ask, so Alon, sorry, you had been in once already and dropped out, and Angel, get your questions if we can, please. No questions? Okay. Please feel free to come off mute and ask your questions if you have any.
Michael, this Tom again. I have
Yeah.
I have some questions regarding the enhanced services. Is that so? Uh, like we enabled some of the items that as a provider to provide like a food and I think refrigerator something like that. But like for example, food. I mean, do we have some guidelines like we needed dietitians to do to do the visit first before we can provide the service, and do you need all documentations something like that? I mean, because we don't have that qualification tab ready yet, so I don't know how to do it. But I think that will be the next step. That once we qualify this this customer, and then we need to go on to refer either internal or external to refer to a provider, right? So
Right. So basically, not to cut you off, I apologize. If you're looking to do something like a medically tailored meal, then yes, a consultation would need and prescription would need to be written by a registered dietitian or nutritionist who will do the interview with the member to ascertain what is the member's nutritional needs, and then that would be that. If you're just doing pantry restocking, then you don't need to have someone that is a registered dietitian for that, but you would need to abide by the state's guidelines on what can be provided. Case in point, you can't provide any type of meat or dairy, but you can definitely provide all the other items that would fall into the hunger prevention, initiative. And I don't have the full name in front of me, but maybe one of my team members can lend assistance with that if they have it on hand. But that would be, as far as the food provision side. If you were providing any other items, utensils, pots and pans, things of that nature, then no, that's not a necessity to have a registered person or someone that's licensed for that. Or even if you're providing things like health bucks or for your members. I don't know if that answered your question for you, but hopefully it did.
Yeah. How about things like refrigerator?
Yeah, no, if somebody needs a refrigerator and you have the capacity to help them get that, then that's fine.
So we don't need the doctor approval or something. I don't know. I mean, is there a written documentation we can follow, a guideline we can follow?
Yes, so the state did release the ops manual, which you can refer to as kind of your first go-to source. And then secondarily, if you look at the payment, the fee
schedule.
Yeah, the fee schedule, you can get a really good breakdown of the services that are available. And it does say specifically on it for certain things where someone would need to be a registered dietitian or nutritionist to perform that function.
Yeah, that. Yeah, I saw that part for the nutrition. Yeah, that's one. That one I saw that in the master agreement. But how about there's so many items that was not clarified. So anything that was not written in the master agreement that we can just simply provide the service if we have capacity to do that. Is that? I mean, for example, refrigerator. If we provide that, do we need to submit a street bid? Let's say.
Correct.
To get one, so do we need to have a documentation to submit along with the service? I mean, I don't know the exactly because we haven't got to that step yet. I don't know what exact documentation you need to satisfy the authorization or anything, to get proper payment. Because later on we need to get an audit, so I need to make sure everything is in line with the compliance.
So there's a
Yeah.
couple of different things. Oh, sorry. Do you want to go ahead, Haley?
Oh, no worries. I was gonna say, no, thank you so much, like Tom, for these questions. I think, as providers are really rolling out the services, like having these nuanced questions is super helpful for us and our team as well. So I just want to say thank you for uplifting that with the example of the refrigerator. I just dropped in the chat, which I hope is accessible to you, the manual that Mike is referring to. And just on the sideline, I'm going to go and look through to get to the exact page number section where what Kimberly and Mike have uplifted, where it details if the state requires, for example, a medical provider to submit attestation that this member doesn't, it is clinically necessary for this member to receive this HRSN service. So I'll find those page numbers and we'll see if they provide the specific guidelines as it relates to refrigeration. But I don't know, I know both Kim and Mike are whizzes at the manual as well. So if you have the page numbers off the top of your head, but I think that might be helpful just to really see the delineation of, what types of enhanced HRSN services do require a level of documentation, whether it be by a dietitian or I believe a physician submitting the attestation form.
Also looking now too, yeah, as well.
So the other thing that is kind of important to know, that for any type of things that are going to be done to an apartment, someone's home, there are two aspects. First off is the need assessment. Does the individual need it? And then the second component, if it's not, something that needs to be done as far as invasive or non-invasive, then it might require the consent of the landlord to have it done. So as far as a refrigerator or an air conditioner, if the need is been identified and it's not doing any real sort of changes to the home, then it's fine. If it's something that needs to have, an invasive action, off topic, but asthma remediation or filtration systems, something that required, some actual physical work being done, then the landlord would need to agree to that. So, but again, that's different than what you're asking, but it still somewhat applies as long as we know that they need the refrigeration for food or medicine. If that's the situation, then then they should be eligible to receive it.
That's helpful. Yeah, that's helpful.
Yeah.
Yeah.
Okay.
I would say refer to page 112 and 113 of the manual that was dropped. It does list some clinical criteria and also lists exactly how the criteria may be validated to determine eligibility, if that's a provider attestation, a member attestation. So you can, if you look at those two pages, 111 to 113, it'll provide you with that specific information regarding the clinical criteria and what type of attestation is needed.
Thank you so much.
For medical tailored meal, Michael, you just said dietitian, both dietitians and nutritionists can verify that, but that's two different levels. Dietitians is harder to find, but nutritionists is easier. So I just want to confirm nutritionists will be sufficient enough to authorize that.
That's what the ops manual says. So yeah.
Okay.
And again, you can look at the fee schedule, and the fee schedule does list the two licenses that are required and or to be able to offer that service.
Okay. All right. So that's really helpful. Thank you. Yeah, I was confused about that. Yeah.
That's right, Tom. We can always follow up with you if there's something else. You can shoot me an email. I know that Esther has my email address.
Yeah. Well, the thing is, we have as a enhanced service provider, there are so many items in there. So when we enable the referral, we want to make sure we fully understand what the requirements are. And also, the fee schedules, also there's something like, it was confusing, like a broker fee. So it's $80,000 it's a cap for the whole term. So I don't know. I mean, it was kind of confusing, right? So if we have something like that, should I just ask you, Michael, or just send an email? Who do I outreach, to get some clarifications when we, I mean, not now, but when we are ready to accept referrals, we want to make sure we're ready to provide the documentations, everything along with the service.
Yeah, Tom, just shoot me an email. If I can't give you a specific answer or direct answer, I will find a team member that can. Okay?
Thank you very much. Yeah.
Okay. All right. Does anyone else have a question they'd like to ask? If so, please come off mute and ask it.
Hi, sorry to join a little late. I have a question about so we have a few new people who are onboarding, have gone through the training, who will be users on the Unite Us platform, but they don't yet have access because they weren't included in our original PRF. I've added them, I've updated the PRF and resent it late last week, I think on Friday. So I'm just kind of wondering, was that the right thing to do? Is there anything else I need to do to get them added into the Unite Us platform? And then about how long does it take before they will have access?
Okay, great question. Thank you very much. So yes, as long as you've submitted your updated PRF user tab with the roles that those individuals will play, and you guys have like a couple of different locations, and if it's assigned to the right location for that, then you're good to go. We've been told by Unitas it takes 5 days, but we did also get a notification they may have got slammed by other, partners that have updated their PRFs and users as well. So it could take as many as 7 to 10 days, but you should be able to go in and check on your Unitas profile under us to see if they are there, and then you just turn them on. So you submitted it last Friday, is that right?
Yeah, I think last Friday.
Okay, so I would check definitely tomorrow, if not Friday for certain.
Okay, and then so I think I just sent it to the PHS, the whole U support email. Does that?
Why didn't you send it to me? You know me. No, I'm kidding. No, that's cool. I'm sure one of our team members flagged it and sent it off.
Okay.
But I can definitely double check for you.
Okay. Or I guess I guess that also the question is, should I have sent it directly to Unite Us? And if so, what is their contact?
It could be sent directly to Unitas. That's not an issue because ultimately it's going to go there anyway.
Mm-hmm.
The only thing, and because this is a revised, PRF, it's not as though it needs to be double checked again on our side. The only thing we are doing is we're retaining a copy so that way we have the most current and up to date partner agreement, registration partner agreement, that is being sent to align with Unite Us. So let me just go ahead and I'll shoot you an email afterwards just to let you know.
Okay, that would be great.
Yeah, not a problem. Okay. Any other questions?
I guess I do have one more question, if you don't mind.
No.
Just generally, are people do you know, have screenings started or is this, because I know, I mean, obviously we're still kind of getting up and running, but I'm just curious to know broadly if folks are starting to do the screenings and et cetera.
To the best of my knowledge, yes. The
Yeah.
screenings have been done, yes.
Yeah, and there's a mix of organizations who are still waiting to like turn on their programs as, you know, they're still just adjusting and trying to get staff trained and ensuring that they have everything that they need. But yes, there are some providers who've already started to screen on the platform so far.
Good afternoon. Is it okay if I,
Hi. Yeah.
Hi, Andrea.
hi, Michael and Kimberly and everyone. I wanted to ask about the PRF because we're adding one more person to the team that's working on this. And I understand that now I need to just resubmit our PRF. And Michael, you may remember this. We also would need to update our PRF in regards to one of the services that we signed up for.
Mm-hmm.
Can I just do everything at once, like resubmit our PRF and make those two changes?
Yes, please.
Yes, please.
Okay.
Yeah. Yes.
Thank you. I'll do so. And just clarifying that moving forward, if we need to add any more team members or change the access to a team member, we just do it through that PRF.
Exactly. Yep.
Thank you.
All things. Yeah. Just update the user tab of the PRF, and then we'll send that to Unitas so they can make the change. And Audrey, you can, you can submit directly to myself and Haley, and we can move that forward for you.
Okay, I was just going to look for who did I send it first, but if you prefer I send it to you and Haley, would you please just type your email address in the chat?
Yes, definitely. Were there any other questions?
Kimberly, while we're on this topic, should I also include the support whole UNYC email address or just email it to you?
You can directly email it to us since our team will just be following up and supporting
Okay,
with all things SCN for your org. So yeah,
thank you.
no problem.
And Elizabeth, your PRF was received on the 6th, updated on the 6th, and sent off on the 6th.
Oh, awesome. That's great. Thank you so much.
My pleasure.
So, and this is actually another, kind of makes me think of another question. When we have questions like this, do we have like a point of contact at PHS that is assigned to? Do you each have like a portfolio of providers that you're working with? or I guess I'm just wondering if it's good, should I just email you directly, Michael, or like how does the workflow work on your end?
It's really going to depend upon what your question is. If it's a workflow question, then you could definitely send an email to me, and then I'll rope in my colleague Gabrielle or one of her team members. If it is something that is Unitas related, then you can. I don't think that there's a problem with having it sent directly to the Unitas people. But let me. Yeah. And if you've joined any of the Unitas calls, you will see that the email would have come from either Nicole or from Ashley. And Ashley Eckert is the sort of like our main interface with Unitas. So you have their email address.
So I would definitely recommend attending that. We'll be recording as well, but I always think it's a little better live personally.
Yeah, my issue is I'm away, like starting on Friday right after that, so I might have to get it going earlier, unfortunately. But yeah, I'm looking forward to that.
Great, thank you. Yeah, and if you have any questions, I put the PDF to the full application in the chat. I'm not sure if you're able to see it. So you can see all the questions there if anything comes up. And we have 4 more minutes if you wanted to review it and see if you have any questions while we're live. Read it one more time. Oh, welcome.
Hi. Sorry, I know you probably have covered all this. I didn't realize that I could hop over. So, so this is on the capacity building. I guess we haven't really started that process yet. Do you have any recommendations for how we?
I'll have to click through the application itself. There are instructions at the beginning that are pretty helpful. I would say in terms of deciding what amount to put in, using the HRSN calculator will be a big help. We'll be having a demo and walkthrough and Q&A of that calculator next Wednesday, the 19th at 11 a.m. at our HRSN stakeholder work group meeting. So definitely recommend attending that to get some more insight. Overall, I mean, the main categories are staffing and other. As we mentioned, you can request funds for hiring staff, providing training, purchasing equipment, or renting office space. I think the biggest caveat is that PHS will be contracting with tier 2 partners who will be providing specialized training. So that's just one thing we'll be reviewing, is that we will be providing training free for organizations in the network. So if that overlaps, we wouldn't be awarding that. One request per organization.
Can I ask a
Those
quick
would be-
question? Because I also have to run to another meeting.
Yeah.
And we can request, because, I mean, we're actually planning to hire somebody, and, you know, we're putting out some funds to hire that person. And can we do that as well as asking for some equipment like laptops or tablets, so that we have the technology to do the screens when we're out in the field?
Yes, you can just put, and sorry, I'm speaking quickly because the room's about to close.
Yeah.
But you can just put that in staffing, the FTE, and then in the other, you would just outline what equipment you would be hoping to purchase and the total amount.
Okay, thank you very much.
No problem. Thank you all. Really appreciate your partnership and work with us on this. Hopefully we'll get some answers to you all pretty shortly, and look forward to reviewing your applications. Thank you.
Thanks.
Welcome, welcome. Hopefully everyone was able to get their questions answered today. Rolitha, do you have any other closing items for today's office hours?
I don't think so. You know, just you mentioned, I think I've mentioned this about 20 times now, but just another plug for our HRSN provider stakeholder work group meeting next Wednesday at 11 a.m. Please join. But thank you all very much. Appreciate your continued partnership.
Thanks, everyone.
Thank you.
Thank you all.